How does sickle cell disease cause jaundice? Imagine your body constantly working to keep your blood healthy and balanced. In sickle cell disease, a genetic condition, the red blood cells are shaped like crescent moons instead of round discs. This unusual shape makes them fragile and prone to breaking apart earlier than normal cells. When these sickled cells break down, they releases hemoglobin, the protein that carries oxygen. The body then processes this hemoglobin into a yellow pigment called bilirubin. Normally, the liver helps clear bilirubin from the blood, but in sickle cell disease, the rapid destruction of red blood cells produces more bilirubin than the liver can handle. This excess bilirubin causes the skin and eyes to turn yellow, a condition known as jaundice. The main reason for jaundice in sickle cell disease is chronic hemolysis, which is the ongoing destruction of sickled red blood cells. Because these cells are fragile, they break apart in the bloodstream and in the spleen, releasing large amounts of hemoglobin. This overloads the liver's ability to conjugate, or process, bilirubin into a form that can be excreted. When the liver cannot keep up, unconjugated bilirubin builds up in the blood, leading to the yellowish appearance of jaundice. In addition, sickled cells can block small blood vessels within the liver, causing blood flow issues and oxygen deprivation to liver tissue. This damage can impair the liver's ability to process bilirubin properly, leading to a buildup of both conjugated and unconjugated bilirubin. This process, sometimes called intrahepatic sickling, can cause liver injury and contribute further to jaundice. Sickle cell hepatopathy is a term used to describe liver problems related to sickle cell disease. It includes various liver complications such as inflammation, scarring, or damage caused by sickled cells blocking blood flow or from repeated blood transfusions that can lead to iron overload. These issues can worsen liver function and increase jaundice. Another factor is the formation of pigment gallstones. Because of the high rate of bilirubin breakdown, pigment stones can develop in the gallbladder. These stones can block the bile ducts, which are responsible for carrying bile from the liver to the intestines. When these ducts are blocked, bilirubin cannot be excreted properly, causing obstructive jaundice, which makes the skin and eyes appear even more yellow. Infections, sickle cell crises, or complications from blood transfusions can also trigger or worsen jaundice. During a sickle cell crisis, increased hemolysis can cause a sudden rise in bilirubin levels. Recognizing jaundice in someone with sickle cell disease is important because it can signal that the disease is active or that there are complications needing medical attention. In summary, jaundice in sickle cell disease results from the rapid destruction of sickled red blood cells producing excess bilirubin, combined with liver damage caused by blood vessel blockages and other complications. The liver struggles to process and eliminate bilirubin, leading to its accumulation in the blood and the characteristic yellowing of the skin and eyes. If you or someone you know has sickle cell disease and notices jaundice, it is essential to consult a healthcare professional to evaluate and manage the underlying causes effectively.